Greetings, dear learners. We were learning metallic poisons. Under that, we finished arsenic and lead. Today, we shall be learning mercury. Mercury, also known as quicksilver or liquid silver. Most of you would have played with the mercury from the broken thermometer. The mercury has a very long history of human use. Roman historians describe the mental retardation, tremors, and ataxia that developed among quicksilver mine workers. Mercury poisoning was common in Middle Ages when it was used for the treatment of syphilis. Chemists researching with the large quantities of mercury, Faraday, Pascal, Sir Isaac Newton, some of the notable examples suffered from the chronic mercury poisoning. Italian musician Pagani was diagnosed with syphilis in 1822 and his remedy included mercury and opium. He displayed classical symptoms of mercury poisoning, namely dental decay, ptylism, and erethism. Occupational poisoning with mercury was also common since a long. Hat industry used the mercury nitrate and the workers in the hat industry suffered from the chronic mercury poisoning that came to be known as hatter's sick or the mad as hatters. Organic mercury compounds were first described in 18th century with fatal cases of the methyl mercury poisoning reported in 1865. Methyl mercury became commercially important as a fungicide around 1914. In 1953, methyl mercury poisoning occurred in a fishing village of the Minamata in Japan. We already discussed the whole case of the Minamata disaster in earlier classes. The mercury came from Shiso Corporation, chemical plant that made the acetaldehyde from the acetylene using mercuric sulfate as a catalyst. Great quantity of the metallic mercury leaked into the metallic bay, where the anaerobic bacteria Methanobacterium omenlaski converted it into the dangerous methyl mercury. These bacteria were consumed by the planktons, which in turn were consumed by the fish, and the poisonous fish were consumed by the unsuspecting public, giving rise to Minamata disease, a neurological syndrome consisting of ataxia, numbness of hands and feet, general muscle weakness, narrowing of the vision field, and damage of the hearing and speech. About 2,000 people were died and 10,000 receives the treatment of the mercury poisoning. Another incident was Basra poison grain disaster that also I discussed in the earlier class when the grain treated with the methyl mercury based fungicide that was intended for planting only and was used by the rural population out of theft to make the bread, following which 500 people died. Mercury is a naturally occurring metal and the mercury movement in the environment is influenced by the various natural and anthropogenic processes. Mercury vapor, a stable gas, naturally evaporates from the Earth's surface. As you can see here in the picture, it gets evaporated from the soil and water and also emitted by the volcanic activity. Human activities such as emission from the coal burning power plants and municipal incinerator contribute to the anthropogenic sources of the mercury. After approximately 1 year, mercury vapors transform into the soluble form, that is mercury plus 2, and it's deposited back to the Earth's surface through the rainwater. Microorganisms can convert this deposited mercury back into the vapor, which may then be released back into the atmosphere. This cycle allows the mercury to recirculate over the long period of time. As you can see here, mercury from the river and other environmental sources goes into the vapor and then come back again into through the rainwater on the surface. And this is the mercury cycle. Mercury that becomes attached to the aquatic sediments undergo the microbial conversions into the methyl mercury. Here the sedimented mercury is consumed by the fishes and the fishes convert into the methyl mercury. This process begins with the planktons, then progresses through the herbivorous fishes and eventually accumulates in the carnivorous fish and sea mammals. Biomethylation and biomagnification of methyl mercury occurs, resulting in the human exposure through the consumption of fish. This poses significant health risks to humans, especially developing fetuses. The same happened in the Minamata disaster. Then mercury is found in different forms. Metallic or elemental mercury is a heavy silvery liquid which is non-toxic because it is poorly absorbed from the intestinal tract, but it vaporizes at room temperature to give off a toxic vapor, mercuric mercury. Volatilization is greatly enhanced by the heating. In its solid state, mercury is a tin-white ductile metal that is malleable enough to be cut with a knife. Salts or compounds of mercury may be inorganic or organic in nature. Inorganic salts are of two types, mercuric, that is bivalent form, and the mercurious, that is monovalent form. Common mercuric salts include the mercuric chloride, which is the white crystalline white powder, corrosive in nature, and the mercuric oxide, which is a red crystalline powder that turns yellow when treated with the caustic soda or the potash. Another the metallic salt is the mercuric sulfide, that is the vermilion or sindoor, which is red crystalline in powder, that need to be differentiated with the lead sulfide, that is again used as a vermilion. The most important mercurious salt is the mercurious chloride, calomel, which is fibrous and heavy. Organic mercurials, that is organic mercury compounds, are generally more toxic and comprises mainly short chain alkyl like methyl mercury, ethyl mercury, long chain alkyl, methoxymethyl, and aryl like the phenyl mercury compounds. Mercurochrome is also an organic mercurial and exists as iridescent green scales readily soluble in water. The most toxic compound of mercury is methyl mercury. A potential source of elemental mercury is at home, which includes the mercury switches, mercury containing devices such as thermometers, thermostats, barometers. Other sources may be the laboratories, dental amalgam filling, cosmetics, calomel, teething powders, and industrial sources. The usual fatal dose of mercury is around 100 grams. For the mercuric chloride, it is 0.5 to 1 gram for an adult male, and mercurious chloride, it is 1.5 to 2 grams per 70 kg of a person. Fatal period is usually a few hours to 1 to 2 weeks. Regarding the toxicokinetics of the mercury, its absorption is possible through all the routes. After inhalation, elemental mercury is readily absorbed, about 80% absorption through the alveolar membrane, and then it enters into the blood stream. Ingestion of mercuric salts is associated with slower rate of absorption. Mercury is rapidly converted into the mercuric ions in the blood, which can lead to renal tubular damages during its excretion. In the central nervous system, mercury acts mainly upon the cerebellum, temporal lobe, basal ganglia, and the corpus callosum. Both organic and inorganic mercurials can be absorbed through the intact skin. The mechanism of action for the mercury is the mercury interact with the sulfhydryl, phosphoryl, carboxyl, and amide groups of the different enzymes, leads to the extensive disruption of the enzymes, their transport mechanism, membrane, and the structural proteins. The direct oxidative impact of mercuric ions leads to necrosis of the proximal convoluted tubules. Immune reaction within the kidney results in the membranous glomerulonephritis and acrodynia linked to the mercury exposure. Methyl mercury impedes the uptake of cysteine by the astrocytes, consequently hindering the production of glutathione, a key antioxidant, and that's result in different types of its effect. That results in the increased oxidative effect on the body. Mercury affects all the system of the body, producing various manifestations. Various effects on the different organ systems may be summarized as: on the brain, it causes memory loss, attention deficit, ataxia, impairment of hearing, vision, sensory disturbances, fatigue, autism in children. On motor system, it causes disruption of motor function, decreased muscular strength, late walking in children. Kidney, it causes increased plasma creatinine level. On heart, it causes alteration of the normal cardiovascular homeostasis. In immune system, it decreases the immunity. Multiple sclerosis and autoimmune thyroiditis are its features. Then on reproductive system, it causes the decreased fertility rate, abnormal offspring. These are the different organ systems that are affected in case of the mercury poisoning. Although the metallic forms of mercury is non-toxic, its vapor as a finely divided small particles can be toxic. The health effects depends on its chemical form, route of exposure and duration of exposure. Toxicity from mercury presents with a diverse clinical manifestation across multiple organ systems, exhibiting varying features and degree of severity. Vapors emitted by elemental mercury and methyl mercury are more readily absorbed compared to the inorganic mercury salts, posing greater harm to the health. Elemental mercury vaporizes easily, and inhaling its vapors can lead to adverse health effects due to its high absorption rate. In general, different forms of mercury target specific systems, like elemental mercury primarily affects the respiratory system through its vapors. Inorganic mercury predominantly affect the kidney and the gastrointestinal tract. Organic mercury primarily influences the central nervous system. Compelling evidences indicates that both inorganic and organic mercury are linked to genotoxicity, teratogenicity, and embryotoxicity. In case of acute poisoning, symptoms usually commence within half an hour after swallowing mercury chloride. In case of acute poisoning, symptoms usually commence within half an hour after swallowing mercury chloride. Initially, individuals may experience an acrid metallic taste, throat constriction, hoarseness, and difficulty breathing. Tongue and mouth can undergo corrosion, followed by burning sensation extending through the abdomen. Vomiting of the grease slimy material streaked with blood may occur, along with the blood-stained diarrhea and tenesmus. Oral ingestion may result in ulcerative gingivitis, glossitis, and jaw necrosis. Nephrotoxicity manifests as albuminuria, uremia, and acidosis with scanty urine containing blood and albumin. Toxic mercury compounds are recognized as nephrotoxic agents, leading to renal, tubular, and the glomerular necrosis. Inhalation of mercury fumes can cause metallic taste, excessive saliva production, gingivitis, and tooth loosening, accompanied by foul breath. A strong concentration of mercury may induce ataxia, paresis, and delirium. Locally, mercury salts exhibit corrosive properties. Peripheral blood smears may reveal the leukocytosis, while leukopenia is associated with organic mercury poisoning. Organic mercury primarily consists of methyl mercury and the phenyl mercury. Methyl mercury is most hazardous mercury species due to its high stability and the position of the ionic properties that leads to high ability to penetrate the membranes in the living organisms. Methyl mercury is mostly presenting with the chronic lead poisoning. Then coming to the chronic mercury poisoning, also known as hydragyrism. In the chronic mercury poisoning, there are the general symptoms that are produced that includes the anemia, anorexia, loss of weight, inflammation of the gums, blue line at the junction of the teeth and gums, as we saw in case of the lead poisoning, sore mouth and throat, loosening of teeth, GIT disturbances, chronic pancreatitis with progressive uremia. Excessive production of the saliva is also the features in case of the chronic lead poisoning. Then the mercurial tremors, mercurial erethism, Mercuria lentis, Acrodynia, and the Hunter-Russel Syndrome are the different findings in case of the chronic mercury poisoning. Coming to each of them, In case of the mercurial tremors, also known as the Danbury tremors or the shakes, glass blower tremors or the shakes, and the Hatter's shakes are the static and intentional tremors seen in the chronic mercury poisoning. The first documentation of the mercurialism among the Hatters was presented by the J. Edison Freeman in the Transaction of the Medical Society of the New Jersey in 1860s. The key features of this mercurialism includes the tremors. These mercurial tremors are basically of two types. These mercurial tremors that has been observed are basically presented in two types. One is the static or resting tremor, occur when the muscle is idle and characterized by fine trembling, primarily noticeable in the upper limbs. Then the intentional or ataxic tremors arises during the purposeful movements of an extremity or exacerbates an existing static tumor. Then the concussion mercurialis is the another finding in mercurialism. Their titinus mercurialis presents with the final stage where tremors intensify to the extent that impedes the daily activities. That is known as the concussion mercurialis. Main predisposing factor for the concussion mercurialis is the consumption of alcohol, which increases the susceptibility to the tremors. Severe tremors are rarely absorbed in individuals abstaining from alcohol. The alternate name of the mercurial tremors, that is the Hatter's shake, the name arose during the 19th century. The manufacture of the hats involved the use of mercury nitrate to strip fur from the pelts. Notably, Abraham Lincoln's iconic beaver stovepipe hat were produced using this method. Poor ventilation in that hat workshops led to the hatters inhaling mercury fumes, resulting in the chronic mercury poisoning. At that time, metal toxicity was poorly understood, often leading to the mistaken belief that affected workers were becoming insane. And from this, the mercury tremors came to known as Hatter's shake, and also the neuroerethism in the Hatters were known as the Mad Hatters. Then the Danbury name has arrived from the Danbury, Connecticut, USA, that earned the reputation as the hat-making capital of the world during 19th century. The industry's peak in the 1880s saw over the 5 million hats annually produced in the 56 different factories. The state of Connecticut prohibited the use of mercury in hat making in early 1940s due to chronic mercury poisoning in the workers. Yet mercury persists in the soil and river sediments near the former factory sites. Then the glass blower 6 frequently manipulate the colored mercury compound in the ornamental glasses, putting them at risk of the mercury poisoning. From there, glass blower streamers and six name arose. Then the classic triad in case of the chronic mercury poisoning is the gingivo-stomatitis, mercurial erethism, that is the neuropsychiatric manifestation of the mercury poisoning, and the mercurial tremors. These three forms the classical triad in case of the mercury poisoning. Then the Mercuria lentis, a distinctive ocular manifestation, occurs in cases of the chronic mercury poisoning. It is characterized by deposition of the mercury onto the anterior lens capsule via the cornea. It was first documented by Atkinson in 1942. The conditions was observed through the slit lamp examination, revealing a matte brown reflex on the anterior lens capsule in 36 out of 70 individuals involved in mercury-related occupations, particularly in thermometer manufacturing. On the slit lamp examination, it reveals a matte brown reflex emanating from the anterior lens capsule. The condition of Mercuria lentis is usually bilateral and doesn't impact the visual acuity. In contrast, the methyl mercury toxicity often results in the visual blurring and the tunnel vision. Mercury pigmentation of the anterior lens capsule may also occur as a secondary effect to the topical medications containing mercury, term as the Mercuria lentis medicamentosus. Notably, miotics containing phenyl mercuric nitrate are implicated in the production of the pharmaceutical related mercury toxicity in the eyes. Additional ocular changes may include the lens opacities and prominent vascularity at the corneoscleral junction. Then acrodynia is the another feature in the chronic mercury poisoning, also known as calomel disease, erythroderma, erythrodermic polyneuropathy, Fierce disease, pink disease, Selters disease and Swift disease. You can see in the children's of the patient with the chronic mercury poisoning, pink color of the palms and soles are very distinguished. So this came to be known as the pink disease. Acrodynia presents as distinctive manifestation of mercury poisoning observed primarily in the children's. Acrodynia presents as a distinctive manifestation of mercury poisoning observed primarily in children's. The salient features include that the child's hand and the feet become painful, paresthetic, peeling of the skin, perspiring and appear pink and puffy. From there, the name acrodynia has come. Acro means extremities, dynia meaning the pain. Painful extremities are the features in case of the acrodynia. Other features encompasses anorexia, hypertension, hypotonia, insomnia, irritability, photophobia and rashes due to excessive perspiration. Symptoms of catecholamine excess such as perspiration, tachycardia and hypertension occur because mercury impedes the degradation pathway of the catecholamines. Differential diagnosis for the acrodynia includes the pheochromocytoma and the Kawasaki diseases. Acrodynia was relatively prevalent among the children during the first half of 20th century, attributed the use of calomel in teething powders for its analgesic action and for washing nappies for its bactericidal properties. There is a lack of correlation between the symptoms and the mercury level, suggesting an idiosyncratic hypersensitivity reaction to the mercury. Mortality rate in case of the acrodynia is around 10%. Then the Hunter-Russel Syndrome is another manifestation of the chronic mercury poisoning. Hunter-Russel Syndrome occurs due to the chronic exposure. Most disastrous epidemic that occurred in the Manamatta disease also showed this Hunter syndrome. The symptoms are basically the central nervous system manifestations that includes the peripheral neuropathy. Major symptoms in this are the echinacea, ataxia, auditory impairments, blurred vision, cerebral ataxia, constricted vision, dementia, depression, diminished or deep tendon reflexes, dysarthria, impaired hearing, smell and taste, malaise, memory loss, numbness, olfactory impairment, paresthesia with preoral and glove-stocking distribution, rigidity, sensory impairments, spasticity, taste impairment, tremors, visual blurring, and tunnel vision and the weakness. The immature brain is especially susceptible to the effects of methyl mercury and is often damaged in an irreversible and profound manner. In case of congenital poisoning, the patient may present with the mental retardation, deafness, blindness, dysphagia, ataxia, microcephaly and the cerebral palsy. However, signs of the peripheral neuropathy are not profound in case of congenital poisoning. The symptoms are due to the loss of myelinated nerve fibers, autonomic dysfunction, sensory nerve conduction delay, abnormal neuronal migration and abnormal central nervous system cell division. So these are all the features in case of the Hunter-Russel syndromes. Then to make the diagnosis of the mercury poisoning, X-ray shall be done as it is radio-opaque. So like the lead compound, it can be visible in the GI tract and in other deposition on the body. Then the blood mercury level shall be done using flameless atomic absorption spectrophotometry. That is the best for deducing the blood mercury level. Normal level in the blood is less than 10 nanogram per ml. Symptoms of toxicity may occur at blood mercury concentration of 50 nanogram per ml or greater. Then the urinary mercury level shall be done. Urinary mercury is the best biological marker for the chronic elemental or inorganic mercury exposure. Urinary mercury concentrations are also useful for assessing the response to chelation therapy. Normal level is less than 20 nanogram per ml. Signs and symptoms of toxicity may begin to occur at urinary mercury concentrations at 100 nanogram per ml. Due to organic mercury elimination by the fecal route, urine mercury level are not indicative of methyl mercury poisoning. As methyl mercury tends to concentrate in the red blood cells, acute total body methyl mercury burden is best reflected by the whole blood level analysis. Then after the urine mercury level, hair analysis may be done using cold vapor atomic absorption spectrophotometry. We already discussed the segmental analysis of the hair for the metallic poisons, that is appropriate here for the chronic mercury poisoning. It can indicate the different dates of the exposure to the mercury. Neutron activation procedure for urine mercury analysis is reported by the WHO as the most accurate and sensitive method to detect the mercury level. Then treatment of the mercury poisoning. The treatment of the mercury poisoning depends on the type of the mercury compound that had been ingested, inhaled or injected. In case of the metallic mercury and the inorganic compounds, that is metallic salts, if it has been inhaled, then the first step shall be the removal from the source of exposure. Then providing the supportive care to the manage symptoms and complication associated with the mercury poisoning shall be done. Then the main step is the chelation therapy that involves the administration of agents that binds to the mercury, facilitating its elimination from the body. Dimercaprol, that is British anti-leucide, was previously used but is associated with adverse side effects. It has been largely replaced by the DMPS 2,3-dimercapto-1-propafan sulfonic acid and DMSA, dimercaptosuccinic acid. We already learned them as the BAL analogs. DMPS administration can be done orally or intravenously. Intravenous administration of DMPS typically involves a dose of 30 mg per kg per day for 5 days, with the option for the repeat treatment if necessary after 5 to 7 days. Orally, dose is 77 mg per kg per day for 5 days and may be repeated as per the need. DMSA is administered orally, typically at a dose of 30 mg per kg per day divided into 3 doses per day for the 5 days. Similar to DMPS, repeat treatment may be considered after 5 to 7 days if necessary. These chelating agents enhance the urine mercury excretion and reduce the blood mercury concentrations, aiding in the removal of mercury from the body. Then, in case of elemental mercury ingestion, the management strategies includes the X-ray examination and repeat imaging. Perform the initial X-ray imaging and repeat it periodically to monitor the progression of mercury within the gastrointestinal tract. If mercury becomes lodged in the appendix, consider appendicectomy. Laxative administration may be given to eliminate the mercury from the digestive system. Emulsions shall be given in case of the corrosive mercury compounds like mercury chloride. It can help to soothe and protect the gastrointestinal lining. Then activated charcoal administration is another strategy. Although metals are generally poorly absorbed by the activated charcoal, inorganic mercuric salts demonstrate significant absorption with the help of the charcoal. Therefore, activated charcoal can be administered to aid in the mercury absorption. Then consider the stomach wash, lavage with the addition of the egg white, 5% albumin or milk to lavage fluid to bind mercury effectively. Then employ whole bubble irrigation with polyethylene glycol solution to help to remove any residual mercury from the gastrointestinal tract. Monitor the progress using the serial radiographs. Then in case of injection of the metallic mercury or the inorganic compound, it may form abscess at the site of injection. So, repeated incisions may be necessary to remove the mercury. Additionally, in case of injectable source, it is important to monitor the central nervous system and the renal function for signs of toxicity. Mercuric salts are relatively well absorbed by the activated charcoal, which can aid in their removal from the body. Chelation therapy may also be considered as the part of the treatment plan to remove the mercury from the body and mitigate the toxicity. Chelation therapy for the mercury involves several agent and protocol, including the British anti-leukicide, DMPS, DMSA, and the D-penicillamine. We already discussed their doses. D-penicillamine is given orally 250 milligrams 4 times a day for adults and 20 milligram per kg per day in case of children for 5 to 10 days. Then to manage the patients with the poisoning of organic mercurials, provide supportive care to manage the symptoms and complications associated with organic mercurial poisonings. Recognize methyl mercury poisoning early, as the neurological impairments associated with it is profound and essentially irreversible. Prevention of neurotoxicity is crucial for the successful outcome. Chelation therapy with the succimer is seen to be of much benefit. While further investigation is needed, chelation therapy with succimer may emerge as the preferred treatment for the methyl mercury poisoning. While further investigation is needed, chelation therapy with succimer may emerge as the preferred treatment for methyl mercury poisoning due to its low toxicity and reported efficacy in animal trials. In severe cases with acute renal failure resulting from any type of mercury exposure, administered N-acetylcysteine alongside with other treatment, as it may enhance the effect of the mercury detoxification. Consider the hemodialysis, hemofiltration, plasma exchange as the renal replacement therapies for severe manifestations with the acute renal failure. However, hemoperfusion is reportedly ineffective in the mercury poisoning cases. In case of the chronic mercury poisoning, chelation therapy is the mainstay of the treatment. So, the chronic patients of mercury poisoning need to be treated with the chelating agents over a period of time, and serial monitoring of the blood and the other levels to check the decrease in the concentration of mercury shall be done. Then, in case of death of the person after the mercury intoxication, although the features on the body are not very specific, the history, clinical features, and the laboratory confirmation is the mainstay of the making diagnosis of the mercury poisoning. In instances of fatal acute mercury poisoning, the mucosa lining the mouth, throat, esophagus, stomach typically displays a grayish hue accompanied by softening and superficial corrosion. You can also, when you touch the mercury, your hands will become the grayish. That is the appearance seen on the gastrointestinal tract on ingestion of the mercury compound. Hemorrhagic points may also be present. In cases of the survival for a few days of post-exposure, ulceration might manifest in the large intestine. Kidney is pale, swollen in appearance due to edema of the renal cortex. Microscopic examination of the renal cortex may reveal the necrotic alteration in the renal tubules. These all may suggest towards the mercury poisoning. However, the confirmation will be done by the laboratory examination of the visceral toxicological analysis report, and then only final opinions shall be given. There is certain other medico-legal importance about the mercury poisoning. Mostly mercury poisoning is accidental. Suicide and homicides are rare phenomena in case of mercury poisoning. Source of exposure in case of the mercury poisoning could be of variety of substances. Exposure to mercury-laden substances and medical practices, substances containing red sulfide, resembling blood stains, and dental amalgams containing mercury poses significant risk. It has been reported that of transmission risk from the individual who consumes seafood and subsequently have elevated mercury levels may inadvertently transmit mercury through the blood transfusions, particularly endangering infants. Illicit activities involving mercury, such as certain abortion procedure, can result in fatal consequences. Certain occupations are more at risk, like dentists are exposed to chronic risk during preparation of amalgams. You can see here the amalgam preparation on the teeth. Then the different manufacturer of the acid batteries, thermometers, and the battery leaks can cause the lead poisoning. The therapeutic use of the mercury compounds also presents dangers, including risk of the accidental poisoning. One of the important concern about the mercury poisoning has been the thiomersal. Thiomersal is a mercury-based preservative used in vaccines, prompting questions about its potential impact on the child development. So, in this way, mercury is being used in our daily life and different types of the products and daily activities where the risk of the mercury poisoning is there. So, such products shall be used very carefully and proper precautions shall be there with the knowledge that the mercury poisoning can present with such type of features. So, this is all related to the mercury poisoning. Thank you.